Good afternoon, guys. Thank you for waiting. Appreciate you guys being patient. Can I just check again? Can you hear me online? Someone can unmute their mic.
Yeah, we can hear you.
Oh, perfect. Thank you. So thank you for joining online. Thank you for joining in person as well. Thanks for joining our second OpSurg session, where we're going to give you some more information on how to maximize your surgical training points whilst at university and during your foundation years. For those of you who don't know, OpSurg or Operation Surgery is a non-profit organisation aimed to bridge the gap between students in sixth forms and universities with a career in surgery, in particular, those from state school backgrounds. If you are interested in joining us and finding out ways in which you can be part of the team, please don't hesitate to contact us. So, in terms of the objectives today, we want to break down the core surgical training scoring system, looking at how to achieve the top grades, understand what evidence is required, but more importantly, how to record it. Finally, we'd like to shine some light on common pitfalls people face in order to avoid invalid commitments. So the reason why we're giving this talk and this series on the whole is because a career in surgery is looking more difficult each year. So we want to encourage you to prepare early to get into core surgical training and show you how you can do that whilst at university, where you will have a lot more time compared to when you start working. Furthermore, the requirements are constantly changing and very much may be different when you're applying for CST in the future, but the overall messages and structure of the portfolio will stay the same. Finally, it doesn't matter whether you're a preclinical or clinical student or a resident doctor, it is never too late to start. And knowing how to correctly record your evidence for research, teaching, and surgical experience will make it so much easier when submitting it for your interview. So here's a list of the surgical specialties that you can apply to take part in during core surgical training as well. So in terms of the most recent changes to the surgical portfolio, the grading system has been converted to a letter system rather than a point system. And we shall explain a bit more of these things in detail later. But a surgical foundation placement, so your four-month placement, will no longer count towards surgical experience. And a quality improvement or audit project should be presented in the department it was designed to improve. So meaning that it should be presented locally to get extra points.
Okay, guys, so it's only right that we start with the actual commitment to surgical specialty. So this is the first part of the domain or the first domain of the portfolio that we'll talk to you guys about. And importantly, we want to stress the difference between operative experience, which is essentially you going in, scrubbing into theatres, and then getting some actual surgical hands-on experience, and compare that with surgical experience, which is a little bit different. So this is when you go away for a week during your practice, and you do a taster week or you do a surgical elective. So let's talk about operative experience first. So we want to emphasize there is never a too early time to start, and it becomes increasingly relevant with your operative experience. So as you can see, that it's based on the number of cases that you've been part of. So importantly, being part of a case means that you've scrubbed in and you've assisted in one way or another. So this could be, operating the suction during the surgery or closing at the end of the surgery. But importantly, if you get 40 cases or more, that scores you the highest points. The way you record this is you get your e-log book and you set that up. It's quite easy online to set it up. And you input the details, which is the student MRN number, sorry, the patient MRN number, the consultant's signature, the consultant's name, and then a little bit of detail on what you actually did during that operation. And then finally, once you've got the cases, you need to complete something called a consolidation report. So what is a consolidation report? It's essentially a summary document where your supervising consultant can sign off the cases, and it's proof that you actually completed those 40 cases and you're not just putting them on. So it can be quite useful to actually do multiple consolidation reports. I know that we said that scoring maximum points is 40 cases, but it's quite useful to kind of do them maybe 10 cases at a time. On the other hand, if you do, let's say, 50 cases in med school, it's quite useful to get a consolidation report at the end of that. And then you can do a separate consolidation report for when you get into F1 or F2. And then it just makes your portfolio much more organized. And I just want to stress again that you can add observed cases onto your e-logbook, as well as cases where you've assisted, and you want to make sure to deselect these in your e-logbook when you talk about your consolidation report. And finally, just to reiterate, it needs to be verified by a consultant. You need the consultant signature, you need the full name, the GMC number, and the actual date of the verification. And make sure you get all these details on the day of the actual surgery, so you don't have to go back in time and retrospectively chase, loads of consultants. This is just an example here. So on the right, you can see the actual e-logbook, whereas on the left, you can see the consolidation report. So it's really not a lot of data that you need to put on there. And I want to stress also that on the right-hand side, you can see that all of those cases were done in general surgery. It doesn't all need to be in the same specialty. As long as you get the cases and there's 40 of them, you will score maximum points, provided that your consolidation report is correct. Okay, moving on to surgical experience. So we mentioned surgical experience is a little bit more nuanced. You can no longer use your foundation surgical placement. So let's say your first placement is in orthopedics, it no longer counts. You need to do either a taster week or you can do an elective, and both of those score equally highest points possible. Now, one of the things that we want to tell you is that your actual surgical elective, if you choose to do one in sixth year, can count as evidence towards this. So if you're really set on surgery, it might be quite useful to do a surgically themed elective and get it signed off. Now, the evidence is quite similar for surgical experience compared to operative experience. You need to get an official letterhead. And often what happens is that the consultant either gives you a letter with a letterhead on, or the secretary does that, and then you actually fill in the details, you show them, and then they sign off at the end of it. And these are just the details to include. There's a little bit more detail here. So importantly, we've underlined the parts that are particularly important in blue. And we want to say that whenever you do these letters, as is the same with all of these portfolio domains, you want to go onto the NHS website and copy them word for word. Because once it comes to presenting your portfolio, when people actually read it, you don't want any caveats. You don't want to have to clarify anything. You just want it to be relevant to the actual evidence.
So now we're going to be talking about quality improvement projects and audit projects. For those of you who aren't familiar with these terms, they're both ways of assessing current practice and whether or how it can be improved. Quality Improvement Project, or QIP, focuses on making changes to improve an area of care using cycles of change and assessment, whilst an audit measures current practice against a defined standard or clinical guidelines, focusing on compliance in that department. The guidelines to get maximum grades in this domain are very clear. It must be a surgically themed project that you have led in all the major aspects, including project design, data collection, presenting the findings, implementing change, and also reassessments. There must be 2 cycles at least, which means measuring outcomes before and after the intervention that you put forward. Furthermore, there's another subdomain to this section that outlines extra grades for presenting your findings locally where you conducted the project, as we mentioned at the start. Firstly, this slide talks about how to get top grades for being involved in a project and how to record the evidence. So you have to have a signed letter from a supervising consultant with these details that you'll have for your other letters, and also a copy of the project presentation or a written summary. So here's an example, and again, we've highlighted you need your name and your GMC number, confirmation that all the requirements were met, and also you'll attach your presentation to this in a PDF. So the second domain is presenting the project. In terms of that, you need a letter of acceptance from the meeting. So that would include your project title, your name, the date, and also the details of the organizer for the meeting. You can also instead include the meeting program, which would also have these details. Here is an example of a letter of acceptance, and as you can tell, it has the date of the meeting, the project title, and also the organizer details as well. So this section might be the part you guys will be most interested in, as getting into research and presenting at conferences is something that medical students often find a bit daunting at the start. And before we discuss the portfolio guidelines for this domain, we thought it'd be a good idea to discuss different ways in which you can get into research and find yourself delivering podium presentations. So, getting into research at UCL, you all have an opportunity to complete an intercalated BSc. And I think it's very, very important, especially for the younger years, to go into this with the intent to publish or present your research. As you know, you may consider it to be a bit of a rest year in between year 2 and 4, but it's important to make the most of this as you are committing a year to this research. And then generally, in terms of getting into research, it's very important to identify doctors who are consistently involved in research and just ask them. And you can do that in person or just by sending an email. And if you do join someone's team or they entrust you to help with a project, the most important thing for you to do is to show that you're a finisher. And what that means is that you're reliable and you meet deadlines to a good standard. And you know, you should know that it is difficult to balance this with your degree and other extracurriculars, but persistence and early planning is important for this, and it's something you'll learn. And in terms of other organizations that you can be involved with whilst at uni, you've got Star Surge, which gets like-minded people who are interested in similar research ideas and topics, brings them together to collaborate on a research project. You've also got academics and different areas of SurgStock who can help you get into research as well. And in terms of presenting, the way you get into that is firstly by writing an abstract, which is a summary of your research, which will include the aims of your project, the methods, the results, and also the conclusions. Okay, so it's a summary, usually around 200 to 300 word summary of your project. And what you'll do is you'll write this and submit it to different conferences and hopefully get accepted. I think it's important to know that generic conferences, it's usually easier to get accepted to present your work. However, if you do a specific project, then you should be aware of all the different types of subspecialty committees and conferences, as you know, that would also increase your chance of being able to present. So make sure you're aware of all the different opportunities out there. So to get maximum grades in this domain, you must have either won a first place prize for an oral podium presentation at a national or international conference, or be the first author of a PubMed cited publication. It's important to know that case reports or editor letters will not get you top points. And in terms of the evidence for presentations, that will include a copy of your slides or poster, a letter of acceptance, or copy of the program, and then also a certificate of attendance. If you're claiming a prize, then you'll require a certificate for this prize or a signed letter from the institution that awarded you it. And it's slightly different for regional or local prizes as well. In terms of publications, there's a lot of information on this slide, but we've outlined the evidence requirements for different types of publications. However, the easiest way of showing this for an article that you have been first author, co-author, or been a collaborative author of is by uploading a PDF of your article with its PubMed ID, usually at the top. Okay.
Okay, so moving on to teaching experience. So we want to talk to you guys a bit about how to set up the actual teaching experience, but in order to do that, let's talk about the basics first. So in order to get maximum points, you need to deliver a minimum of 4 sessions. And the way that we'd encourage you guys to start or get the ball rolling on this is just to approach your undergraduate department lead or each of your trusts. There will be some clinical teaching fellows, and they're usually congregate in an office somewhere. So go in that office and just start talking to them about certain opportunities that may present themselves. And to actually sign off on this, you will need a consultant, and we really encourage early communication. So as we said before a little bit, you don't want to have to get evidence retrospectively and present this to a consultant. You want them to be involved throughout the whole process and for them to kind of collaborate with you on this. Finally, formal feedback, very important. So after each session, you want to set up a short feedback form, whether that's a QR code, a link, however you want to do it. But this is essentially going to form the backbone of your proof that you actually completed these sessions to a desirable standard. And your consultant will have to review these as well. Finally, a little bit like your consolidation report equivalent for the surgical section, there also needs to be some form of evidence from your consultant, and that is in the form of a letter that he signs where he talks about sort of what the sessions were. Now, a little bit about the scoring. So as you can see, the main points from grade A that I'd like to highlight is that you've worked with local educators. So that involves your collaboration with the clinical teaching fellows. Finally, or not finally, but secondly, you want to run them face to face. So as you can see, it's actually only a grade B if you run them online. But it doesn't have to be in a fancy lecture theatre. It could be in a room. As long as some people attend face to face, it counts. And finally, you want to deliver 4+ sessions. Now, how do you actually provide evidence? So there's two methods. Method one is where the consultant who is overseeing the teaching sessions, he confirms that you've taken part, again, with his name, his GMC number, the dates of the activities, and finally by signing off. And this method requires you to kind of compile all of those feedback forms and attach them directly to your portfolio. Now, method two is slightly different and arguably easier as well. So that the same part, the first part is the same. So the consultant kind of reviews all the sessions and talks to and makes a note of all the things that you did, that you were involved in the planning, that you were involved in the face-to-face delivery of these sessions. But it also involves the consultant looking through personally the feedback forms and including that part in the letter. But in all cases, make sure to record the dates of each teaching session and where they were delivered. Of course, record the feedback forms. And it goes without say, but just to say it anyway, digitalize all of the evidence. Even if you do paper feedback forms, make sure you scan them in and you compile them in one PDF document. So this is what the actual evidence looks like. As you can see, this is method two. So the consultant just confirms that the feedback forms prove that you delivered these sessions to a desirable standard and that that can be counted as evidence to your teaching experience. And with all of these letters from the consultants, you will need the signature, the name, the GMC number, and so on. So just a bit of a summary of the evidence. As you can see, the publications and presentations take up the biggest chunk of this, but I hope that we've clarified a lot of it. And for each domain, I hope that we've clarified each step. But there will be time for questions at the end if something needs a little bit more clarity. And just a bit of advice on how to record the evidence. So we want to reiterate that sometimes your evidence may be in paper form, but always digitalize it. It's just easier and you'll thank yourself in the future. And importantly, the actual portfolio itself is a self-assessment thing. So you submit it before you actually get your interview, and eventually they'll have 10 minutes. The people running your interview will have 10 minutes to look through your portfolio, and you won't be able to clarify anything. So if there's evidence in there that doesn't meet the selected NHS criteria, then they will have to discount that evidence, which could be quite tragic. And finally, for each domain, the NHS actually, the details on the NHS website, they want you to save each domain as one PDF file rather than multiple, which makes your life a lot easier as well because you don't have hundreds of documents. It's just one document for each domain. Now, common pitfalls. As mentioned earlier, your assessors only get 10 minutes to review your portfolio, and that means that you're not actually involved in that process. They get the portfolio in their hands, and then they have to go through, and they can't ask you questions about whether, certain parts of each domain actually meet the evidence criteria. It will have to be self-evident. So we've mentioned this a few times during this session, but go onto the NHS website, check exactly what the criteria are that you need to satisfy, and then copy and paste those into each parts or each evidence letters that the consultant then signs. So yeah, use the submission guidance. Another thing is, we mentioned this too, but if you get a consultant, let's say for the teaching domain, and you only tell them retrospectively that you committed to these 4 teaching sessions, it'll be really difficult for them to really sign that because they will require way more evidence than if you involve them from the onset and have them kind of sign off bit by bit. Finally, seek advice early on. And with signatures and verification, there's one very important caveat. So we would always recommend in-person signatures because they can't be forged. We know that you guys wouldn't forge any evidence, but it's just something that they have to include. If there are e-signatures in any of the documents, make sure that they're in a form or in a PDF style where you can't edit the signatures after the fact. If you do include that, unfortunately, that's inadmissible evidence, and it scores 0 for you, which again would be terrible. Now, patient identifiable data, med school love talking about not including this and sort of patient confidentiality. It forms a really important part of your professionalism. So never include anything with patient identifiable data. Otherwise, again, that's discounted from your portfolio, and you actually have to have a meeting with your supervisor, which is not what you want. And finally, uploading it, only do one PDF per domain, all relevant items, and avoid duplicates. Now, just a little point as well. So let's say you complete an audit or a quality improvement project and you get that published. So you cannot submit that as a publication for both domains there. You have to do a separate publication for your actual paper that you end up submitting for the publications or presentations domain. And finally, we've got some tips from an actual person in core surgical training.
Yeah, so I spoke to my friend who's in CST1 as well, just to, ask what would be good advice for medical students and those in foundation years. For senior medical students who we have in the room at the moment, he recommended to try and start with a surgical job. It's not be all end all for all these reasons, but what it does do, it makes it a bit easier to start a quality improvement project early and have time to get the second cycle done, especially if you're going to be moving to a different hospital during your foundation training. And secondly, knowing the team early means that you can talk to them about getting more theatre time and being involved with different projects. And furthermore, which is also relevant to foundation year doctors, if you're going to do a taste a week, it's a good idea to do it in a specialty that you may not enjoy as much, just to break it up. And for any foundation doctors who've joined today, this guy who's in CST1, he didn't do much for his portfolio before, like during med school at all. He literally did it all in F1, and he said it was hard, but he also said that's something that you can totally focus on. The portfolio makes up a big chunk of your interview to get into core surgical training, and it's something that's fully in your control. So make sure you focus on that during your first year, because in F2, you'll be focusing on your MSRA and other exams as well. So thank you guys for listening. Are there any questions? And also here's the feedback form. If you want the slides, then it's important that you do fill out the form and include your email on this so we can send it to you. So I saw one of the questions on the chat was about, does teaching or let's say any experience count if you're doing it in medical school? So from what I've seen, there's points where some sources will say, oh, you have to do it all after. But anecdotally, from people who did teaching or did things during medical school, it all counted in the end. And as we said earlier, the requirements might change. They might become very, very explicit in what they mean. They might just take it out altogether. And at the end of the day, any experience is very useful for you. So I wouldn't let that stop you from doing any teaching if that was the case. Okay, any questions from anyone in the crowd or from anyone left in there? Okay.
Yeah. All right. Thank you guys for joining. Just a few more things as well. If you do get the slides, every link that we've kind of talked about, especially the guidance on the NHS website, it will all be on these key links slide. And then this is their team. But yeah, I'll just go back to the feedback, guys. If any of you haven't filled it out yet, please do so. And then we'll stop recording.